Hi guys! Today I'm going to talk to you about a resting hand orthoses. An orthoses is basically a rigid or semi-rigid device that is used to protect or support a weakened or deformed part of the body, and it usually restricts or eliminates movement in the diseased or deformed part of the body. Typically, occupational therapists utilize splinting techniques and orthotic devices for the hand and upper extremity, but in some cases they also utilize these techniques in the lower extremities as well. An orthotic device is classified as a preparatory intervention, so that is not the main part of your treatment plan, but it is an important part. So a resting hand orthoses is a static splint, and basically what that means are static splints have no movable parts, but a resting hand splint and a static splint are not synonymous. Static splints can be progressive, which means that the therapist can change and mold that device as that patient is making functional gains, but that does not happen with a resting hand orthoses. A resting hand orthoses is typically only to be worn at night, and it is not refabricated. I have a picture to show you. This is the typical one that is used. The orthoses positions the hand in 20 to 30 degrees of wrist extension and 40 to 60 degrees of MP flexion and 15 to 30 degrees of PIP and DIP flexion. And the splint may be placed on the volar or dorsal side of the body. So we have all created splints in Ed's class, but just to kind of review the steps of creating an orthotic device is, number one, you are going to create your pattern. So I have an example of what a pattern of a resting hand splint looks like. It, to me, reminds me of a mitten. So first you make your pattern, and then you choose the appropriate material, which we know is a towel, scissors, thermoplastic material for the device, Velcro. You have your splinting scissors, and then you are going to choose the type of traction. So in our case, it is a static for the resting hand splint. And then you will choose your design, and step 5 is fabricating the device. So the implications for use, this orthoses is mainly used in anybody that has a neurological condition, such as a stroke, a spinal cord injury, a traumatic brain injury, a multi-trauma. I know that a resting hand splint is typically utilized in persons who have sustained a C6 spinal cord injury. And the therapist utilizing this technique is most likely working in an inpatient or acute setting. These splints are also fabricated in an outpatient setting as well, and that is typically patients that have less severe cases such as rheumatoid arthritis and arthritis. And like I said before, they're used at night. Trying to think of anything else. A lot of the research I've seen has been on stroke patients. So I feel like that's a very common condition in which the splint is utilized. And I think it doesn't seem to be too difficult based on the videos that I watched. So I think a few times practice makes perfect, right? But I think that is basically all about the resting hand orthoses. I will let you see it one more time in all its glory. And I hope you have a fabulous day.